Hi, I'm Julie Mentor, the movement leader for Embrace. It's Mother's Month, and we're asking the question, what would it look like if the world was truly built with mothers in mind? One where we have policies, systems, and people who are working to actively make the world better for mothers. Each week, we'll be sharing conversations with Embrace Network partners who are boldly working towards this vision of making the world a better place for mothers. Today, I'm talking with Amanda Mokoena. She is the founder of the Glow Movement NPO, and she's also a Mamandla 2021 Fellow. Amanda is using tech to tackle some of the very real challenges that mothers face, that of trying to access reliable, safe, and affordable transport for themselves and their children. In a world built for mothers, what does safe, reliable, affordable transport actually look like? Is it possible? And what is it going to take for us to achieve it? Amanda Mokoena is a teacher by profession. She is a very proud mom to two beautiful girls. And she's also a maternal health activist. She is a leader in her community as the founder of the Glow Movement NPO, and she works really hard to improve access for mothers to mental health services and to support groups so that they can feel supported and less alone in their motherhood journeys. If you like what you're hearing today, please get in touch with Embrace. You can follow us on all the social media channels, or you can reach out to us via our website, embrace.org.za. So Amanda, please tell us a little bit about who Amanda Mokoena is.
I'm a mom of two. I'm the founder of Glow Movement NPO, an organization that support mothers. We are a mom support network. So what we basically do is we focus on maternal mental health. We support moms with their mental health, antenatal support, and postnatal support, and ensure that they thrive and their children thrive.
So Amanda, we're talking to you today because we want to understand a bit about this wonderful new app you're developing that is really going to transform how mothers are able to engage with transport services. The app is called mobimom.com. What is it? Can you tell us a bit about it?
So mobimom.com is tackling a hidden crisis for mom. I'm saying hidden because nobody thinks about it. If only you're a mom and you were in that situation, you can only think about it as a gap or as a need. So mom.com is how unsafe and unreliable and inconsiderate the public transport is for mothers. So when I gave birth to my daughter, my last born, she was born prematurely, and I had to travel to hospital every day using e-hailing services. So I had a C-section. I was still recovering from that, and I had to travel every day relying on e-hailing services. And I realized that I had, to be. I realized that the drivers are not understanding the situation that I'm in right now, because the way the drivers were moving was very rough, and I was, always in pain. And one day, my stitch really got. I had to be restitched. I had to be restitched because of a rough ride. So that's when I realized that how many moms are really going through the same. And it was not a coincidence. In the same week, I had a mom who also got restitched because of a rough ride in that particular week. So that's when I realized that we need transport that understands mothers' needs. And not only mothers who are expecting or mothers who have new babies, but mothers who have children with disabilities. So that's when we thought of having an e-hailing services, training our drivers who are have to be empathetic. They have to understand carrying a family or mothers or child with disabilities. I need to assist them getting into a car and getting to where they go. In the same month, who I heard that she was not coming to see baby, in the hospital, and the problem is that she was not having transport to come to the hospital. And they do have rooms for moms who cannot afford to come to hospital every day at the hospital, but it's only limited to a certain amount of moms. So when I found out about that, then I realized that there's really a need for moms to have this transport. My mom told me back in the days there was transport bringing them into hospitals to check their babies, but I realized this is a huge gap now. If you can't afford to come to the hospital, you can't breastfeed your baby, you can't see your baby. So because I run an NPO, and this is also a business, the mobimom.com, because I do work with mom from underprivileged um, backgrounds, these rights will be subsidized, and also we're trying to find people with funding. Moms will be getting rights from home to hospital to check on their babies, especially those who gave to babies prematurely or sick babies, etc. But yeah, this is how mobimom.com was born, to support moms in mobility, because I, as a mom, and the moms I've saw in the hospital, this is a gap, and it's really, no one really thought about it to say, could we have this as a problem? But if you are in a situation, you realize that it is actually a problem, because giving birth is not easy. We all know you have pains. We give birth to premature babies, something that you didn't ask for. Unfortunately, you have to travel back and forth. But if you don't have drivers who understand that you are in pain and they have to drive politely until you get home, then we have a problem, because then we face problems like restitching, which is very painful.
Absolutely. Yeah. I can't imagine what that must be like, having been through cesarean sections myself and knowing how sensitive my body felt in that moment, and then needing to also see to the needs of a baby who is requiring special additional care and is away from me. I can't imagine how painful that must have been. I'm so sorry that you experienced that. And yet through that experience, your own sensitivity has been heightened to what other mothers are going through. I like what how you identify the problem as being both one about sensitivity and affordability, right? So it's not just about providing a cheap ride, but providing an affordable transport service that is dignified and caring and understanding of how vulnerable that postpartum experience is, or how vulnerable transport is if you are traveling with a child who has a disability, or if you yourself have a disability and require additional support when taking transport. It's an incredible thing you're doing, Amanda. Thank you so much for being on that journey. So, part of what we're doing as Embrace this month is we're imagining what a world for mothers would look like, right? So, what would it look like if we had systems and policies in place and people understanding the needs of moms in leadership to really build an ecosystem that supported the motherhood experience right from the start all the way through? And I'm wondering if you could just help us further understand how you imagine transport looking if it really was built with mothers in mind, beyond what you are developing for yourself, but transport in general for the mothers who have to use it. What would it look like if it was built with mothers in mind?
First of all, I'm going to make example of Baragwanath's hospital, because it's the biggest hospital in Africa, and we have the taxi rank next to that particular hospital. And when you see the taxis, they are not accommodating of mothers. First of all, you have to sit squeezed in with a new baby going home. You're in pain. But if the transport system was thinking of mothers, we have at least front seat with more space for mothers. You are thinking of a mother that's just discharged, especially if you're next to a hospital. You should know that a lot of moms will be going home with a baby. So these transport systems need to bear in mind that you cannot be sitting cramped with the baby. If they had more stay when they create these taxis or transport, if they keep a mom in mind that we need to give her space in front, and this is from a new mom who has a baby, and a mom with a child with disabilities, because then sometimes you have to carry them. They can't sit on their own. So there's no enough space. That's what I see every day. A mom has to sit so cramped. with a baby and the baby is uncomfortable, the baby is disabled, you also don't want to hurt them. So if they kept that in mind, that moms have to take children to checkups every day, and they need to sit comfortably with their children. Moms give birth every day, and not all moms drive cars, not moms afford e-hailing services. How would we support motherhood? How can a mother sit in a cramped space? So if they kept that in mind, I think we'd have a different conversation now, because then we'd have enough space just dedicated for moms in a taxi. And I know they always say front seat, but front seat is not it's not spacious enough for a mom to sit there with a baby. If they could, um, think about mothers as well when they create cars or taxis for public transport, that would be amazing. Because um, my baby was there for 6 months in the hospital, and I had created a small WhatsApp group for moms with children in preemie. And what moms go through every day is really heartbreaking. Moms cannot get to the hospital to see their babies, first of all. Second of all, you have a C-section, you have complications, you still have to sit in a taxi where you are cramped, you're hurt, you're getting home, you're not okay, you're coming back, you need to be restitched, or you have an infection because your wound is not healing very well. So if they could keep that in mind, um, back in the days, my mom was born way back. There was transport taking moms from home. I'm sure you also know of this story your parents told you. But now we don't have that. It's like you need to see for yourself. You need to go home, and we are not equal. We're not the same. So I think that if people create things and they think of motherhood, we would have a different conversation when it comes to mothers dying of complications every day. We have over 1,000 mothers who die of complications in South Africa. Uh, could be that they had infection because they had to travel every day to the hospital. The wound was not healing, so they got infection, things like that. So yeah, I think really, if in everything that we do, things like transport mobility, we should think of motherhood, because it is a serious issue.
I am wondering, we want to talk about your app in a bit more detail, and we'll get to that now. I'm wondering if you're aware of any conversations that have been had with the National Taxi Association, with other providers of public transport services. Has anyone, to your knowledge, ever approached them with a conversation around how to support mothers, maybe specifically those public service providers, or public transport service providers, should I say, who are, as you say, located around hospital facilities, who, as you say, should know that many of the people that the passengers that they're carrying, would have either just been discharged or have a small baby with them. Has that conversation been broached?
Not what I know of. I don't know if anyone did at some point, but not what I know of. When I spoke to a nurse one day, we had the same conversation. It's like, I've been a nurse here for over 30 years, and what you're doing with moms, because I was telling her the work that I do with moms is amazing. And then she brought that up at some point to say, for example, the transport system is not in support of mothers, and no one has said anything thus far since I've been here in this hospital. So I'm not sure whether they have it in the corridors, in the backgrounds, but I've never heard of any conversation or petitions that we must sign to support mothers, especially mothers with children with disabilities struggle every day to take their children to check up. Sometimes there's no enough space for them to get there. Sometimes, as most of them are on a wheelchair, mothers don't take their children to the hospital for checkup because they are avoiding to use a taxi. There's no space for the wheelchair, first of all. They cannot afford e-hailing, prices are sky high. So things like that. I don't think people think about that every day, but yeah.
Yeah, I think it's just a really interesting point, and maybe something that we should look into picking up, or who would be the right person to have these kind of conversations with, or where we could channel this sort of energy. Because I think that uh, your solution, what you're proposing as your solution through mobimom.com is one piece of the puzzle, but there will be many solutions required if we're going to think about transport and
Yes.
how transport serves mothers around the country in urban settings, in rural settings.
In rural,
We're going to
yes.
need to be really creative, and so it sounds like there's some really important conversations that need to be had at provincial and national level around transport services that are mom friendly. So Amanda, as the developer of mobimom.com, can you tell us a little bit more about the app? Where are you at in its sort of production stage, and what will the app actually look like? How will users be able to interact with it and make it work for them?
So where we are at right now, so I'm part of a fellowship, the Fourth Philanthropy Fellowship, powered by Watson Institute. So part of the fellowship is to support me and help me understand my venture in mobility. So where we are at is that the app is created, but it's not live yet. So, what is on the app is moms requesting a ride, and you have to be specific whether you're requesting a ride for a child with disability, so that you can be accommodated, and the age of the child, so that the car can come with a car seat, etc. And also have to specify whether you're pregnant, etc., or you just gave birth, so that we know who to send to you. So that's on the app. You choose that, and then what we added on the app as well is some extra features like helping moms find nannies, because I've created a feature because I have a lot of moms asking me where to find good nannies for their baby. So we link and trained nannies there on the website, I mean on the app, as well as we'll be partnering with local businesses who are selling mommy and baby care and services like mental health, any other service that could support moms they could have access to on that particular app. So where we are at, the web is created, and what they are preparing me to do is to pitch and find more investors for the app. The first pitch is in June, which is for Fort Philanthropy, where me and the other people who are part of the fellowship will be pitching our business idea, and then you have to sell your venture and hopefully get some funding to actually get your app running and live. So that's where we are at. I've recently also through a contact receive a call from Department of Transport. They will be having a summit. I think it's in September, if not October. So they also asked me to pitch for that, because they think like this is a solution that will really be helpful for mothers. I think that's where the conversation that you talk about can come in, where we'll find people on those levels, national level and whatever, to propose this particular problem that we are having as mothers in South Africa. So yeah, that's where we are at.
Thanks. That's really exciting. And it sounds like you've got a lot of ideas to make this app really work for moms. I'm wondering if you can tell us a bit about your ideal driver. Who is going to be the driver that provides the transport? I know that female drivers often struggle to find their place in more traditional e-hailing services, and where we're definitely trying to boost the economy for women entrepreneurs. Is this a space that they could thrive? Could they join mobimom.com as drivers for you?
Yes, I mean, that's a good question, Julie. That's what we have in mind. We want mothers to thrive, because even when you are requesting a ride and you really need a woman driver, you don't find them there for various reasons. Their safety, I think it hasn't been safe for them. And also, yeah, I think they haven't found their place into the e-hailing. But we want to support mothers. We want women drivers, people understand that this is what this business is about. So we want to, even with the pre-launch that I'm having, spoke to Nkuli about it. We'll be having women drivers who've been in business, those who've tried e-hailing but didn't succeed, those who are doing your take a lot deliveries who want to be in this business. This could also be another way of making an income. So yeah, I mean, women are our first people we will be training on this business, and they will be our go-to people, especially like it's a app created by moms for moms. That's what I always say. It's not only me, but I feel like the other moms also feel the same. So
Sounds amazing. I can't wait to see it go. I really hope that you get that key investment to launch, to train your drivers, and ultimately to be able to subsidize the rides. Am I understanding that that is part of the model, is that the
yes,
rides
yes,
become
yes.
affordable?
Most important model, because I have a lot of moms from disadvantaged background. If I do that, then I don't know why I'd be creating this app, because any other mom who has money can afford to book transport, any comfortable transport for themselves. But this is mainly for moms who can't afford.
In the event that someone's listening to this episode, Amanda, who is potentially an investor, a funder, someone who'd really like to support this business, who's listening to this idea saying, yes, oh my gosh, it makes sense. I'd love to get behind this. I'd love to be supporting female entrepreneurship, supporting the needs of a very real need that you've articulated so well for mothers. How can they get involved? Yeah, how can they support you? And for someone who's maybe listening, really keen on the idea, maybe not able to be a monetary investor, is there any other way that we can support you at this stage?
Other resource I could use, besides money, well, we need money to run the app, is also if you are a resource yourself, you know how, because we want the app to be live, but I don't know those options yet on which one, who I should go with and who should handle all of this. That would be great for us. You can reach out and support us, because, I'm creating this app, but I'm not that much into tech. I'm still learning. So if anyone can support us in which direction we can go through, I know the app is there, it's created, but I just need, hosts for this app, for example. Yeah, and your software gurus, etc. So if I could get help from those people, it would be great.
Amazing. And are you launching online? Is there a social media presence that we can get behind and promote?
Not yet. I'm still creating the pages as part of my fellowship requirement. So it will be running um, by end of May. So we'll be having. I'm creating right now. I'm creating the pages. The pages will be running. Social media pages will be running before May, but the pre-launch is on the 28th of May, where I'll be having a conversations with moms with disability, with children with disabilities, pregnant moms, and moms who are really affected. So what we want to do is we need the data that mom speaks for themselves. Yes, I came with a solution, but we also want to hear their voices, moms, what they've been through when it comes to these challenges in mobility, especially for moms who had children with disabilities and has been taking their children for checkups all these years. So I have partnered with a few Mamandla Fellows who are running these organizations, especially with children with disabilities, etc. So yeah, that's looking great. I think we'll get those responses from moms, and yeah, but I will share also in our Mamandla groups once our social media pages go live, so that they can be shared. I'll share those.
Oh, wonderful. I'll hold you to that, Amanda. And as an Embrace Network member, we will be sure to amplify your work as soon as it's ready, end of May. Whatever you share, we'll be sharing and encouraging others to support, because this really is, you're addressing something that you say is such an unseen struggle. It's something that people just assume that the mom gets from A to B and not really think about how what her experience of that is like, and how possible or impossible it is to be a present mother when you've got a very real barrier like transport between you and your child who is potentially still in hospital. So you've been doing some really critical thinking, and we're really so grateful. We're so excited to watch you as you continue to build this app and get support for it. And we're hoping that we'll be your early champions supporting this work and encouraging others to use the app for themselves. Amanda, just one last question before we let you go, and thank you so much for your time today. I want to ask you, we're asking our audience to think about what a world for mothers means. We're saying this phrase this month because we really are wanting to get people thinking about how inclusive, or should I say currently exclusive, um, the world is in terms of how it treats moms, and how moms are able to actually engage in the services that they need in order to show up for themselves and their families. And so when we work to think about the phrase a world of moms and we talk about that, what does that mean for you? What does a world for mothers look like for Amanda?
I think a world for mothers is a world where you have access to support, because motherhood, there's no such a thing as solo motherhood. It's hard. I know every day I work with mothers, they're going through the most. As much as they have partners, they would say, "Yes, I do have a husband," but I don't think they really understand what I'm currently going through. And I think another mother would understand. So, a world where they have access to support when they need one. For example, when you come from hospital, you're a first time mom, if you have access to what you will be looking forward to as a mom. For example, you are given a guide on this is what you should expect. Some moms don't even know what colic is, why a baby is crying. They don't know what baby blues are. When they are going through baby blues, they're thinking they're going crazy. They're saying they hate their babies. They're imagining things. I recently had the mom say, "I'm seeing things. I don't know what's happening with me. I'm a first time mom. Can you please talk to me or refer me to a professional?" So moms having access to those resources and having access to people who support them would be amazing. Motherhood shouldn't be hard. It shouldn't be hated. It's a beautiful thing. So some moms hate motherhood because you didn't get support from firsthand. But if you go to the hospital, you should. Yes, our hospitals, public hospitals, are overburdened. So, I mean, it's hard for them to even support you and say this is what you're gonna expect. You just get a baby, get your meds or whatever, go home. But if you have a guide, given a guide, this is your guide. This is a pack. This is who you need to support. Who will support you. These are the organizations, this is who you can reach out to. Having that support at hand, the resources at hand when you are giving birth would be amazing. A world where you feel like you have it figured out because you are supported by a community. So I think that would be amazing.
Support, support, support. We can't get enough of it. That's a beautiful message to leave us with today, Amanda. Thank you so much for your time and sharing your really exciting app with us today. MobiMom.com. We will be linking to it as soon as it's online. So make sure you're following Embrace to keep up to date with what Amanda is doing and what our other network members are doing to make the world a better place for mothers. Thank you so much, Amanda.
Thank you for this afforded opportunity, Jules, and believing in my app. And I know because you run a huge mom support network yourself. Um, thank you for having me, because if I have you, also I have the other mothers. I also have the other support from the other fellows and other Embrace members who are mothers.
Thanks so much for listening in today. If you want to catch the rest of the conversations that are happening as part of our World for Mothers series, make sure you follow along on our social media channels, or you can subscribe to our newsletter on our website, embrace.org.za.